Assalamu alaikum and welcome to another episode of Health in Islam. I'm Ismaeel Chartier, and with me again today we are very happy to have Dr. Abdul Hadi Misbah, a professor of immunology and microbiology and a fellow of the American Academy of Immunology. Today we're going to talk about the immune system between stress and pain and how it functions this way. Jazakallahu khair, and thank you very much for being here, Doctor.
Thank you.
And this sounds like a very fascinating and interesting topic to me as a layperson, so I'd love to know how it works. So we used to say that stress affects our body and health. We need to know how this could happen.
Bismillah ar-Rahman ar-Rahim. You know, as you said, stress, of course, affects our whole body. Since long time, we know that when we get angry, we get a lack of energy. We become easy fatigued. We don't want to work. We get sick a lot of times. But the basis, the scientific base for this is actually known since just in the last 20 years. When the immunology science get advanced and we knew that the immune system and the central nervous system are closely related to each other through the endocrine system. The endocrine system means the glands in the body, different glands in the body,
Pituitary gland,
which produces different hormones that affects all our activities. As you see in the graph, we have emotional response sometimes to some behaviors, and we have physiological response and behavioral response. These physiological responses cause the nervous system and the endocrine system to work. The nervous system produces catecholamines, which produce epinephrine and norepinephrine, which are the stressors.
the ones that put stress on your body.
Yeah,
They're the ones that say, hey, what's wrong with you?
That's correct. In the fighting spirit.
Okay.
And the endocrine system produces glucocorticoids, and this is cortisol, which is very important for the activity of the body itself. And those are destructive hormones. Both adrenaline and epinephrine and norepinephrine are destructive.
They hurt the body.
Yeah. So the stress actually affects the sympathetic system or the sympathetic nerves, which is involuntary autonomic nervous system. And that causes increase in the heart rate, increase in the blood pressure, increase in the respiration. It affects the digestion. You become dry mouth. You increase blood flow to the muscles and decreased in the peripheral. You find yourself pale in the periphery. Your face, your hands are pale. And this is also appears a lot in your stress or your anger.
This is all because you're stressed.
Yeah, that's correct.
All these killers, they come out and they start messing with you.
That's correct. And then after that, you find that activation of the sympathetic system actually through what's called the pituitary adrenocortical axis. The pituitary gland is the master gland in our brain.
Controls everything. When you start puberty, when you do everything.
So it stimulates the glucocorticoid secretions from the suprarenal gland and the adrenaline, epinephrine and norepinephrine. This is the pituitary adrenal axis. And you see it's affected by the stress hormones.
Is this what gives us the fight or flight reflex?
That's correct. That's correct. And then you find the cortisol affects the circadian rhythm, I mean the biological clock.
If you can't sleep right,
Yeah.
when you do go to sleep, you're tossing and turning.
You find yourself.
This is all from being stressed and being angry.
Yeah, that's correct. And all these actually affects the stress.
You know, Rasul Sallallahu said, a man came to the Messenger of Allah Sallallahu said, give me a piece of advice. So Muhammad Sallallahu said, don't be upset. He said it 3 times, don't be upset, don't be upset. And look what it does to you. This is good advice.
That's correct. Yeah. As you see, this is actually what the stress do, and all these hormones and all these
chemical reactions
affects the immune system. So you find that 2 brothers in the same house, one is relaxed and he doesn't get nervous easily, and the other is very nervous, you find that this nervous child gets flu many times in the year, and the other one
Doesn't.
doesn't.
The one who's cool as a cucumber he's good all year.
Yeah, although they are in the same room.
Same environment.
Same
house.
environment. Because, his immune system is intact, and he is sound.
He's not all.
He is not working or exhausting all the time due to his stress.
SubhanAllah. Can you give us an example from our daily behaviors that could affect our immunity, like going through a divorce or going through a marriage, or raising kids?
This is a very interesting topic, because they did researches in the effect of daily behavior on the immune system through the stress. They found that happy marriage improves immunity, and vice versa. And they found that the divorced ones who were happy, their immune system gets sick after their divorce.
After the divorce. It's like Rasulullah said, my sunnah is to marry, and those who don't do it aren't from me.
Yeah. And they found also that the students during examinations, before examinations,
midterms, they're a killer.
get nervous, and their immune system actually is weakened, and that appears in different symptoms like falling of hair, like allergy, like
hair falling.
pain, stomach pain, and all these things are due to their nervousness and tension or stress.
I know when I would be studying for midterms in school, you had a big exam, and you were stressed.
Yeah, they
like,
did
"Oh,
it
I don't
actually.
pass."
They did it actually in the medical school.
So you have one step even higher than just regular school.
Yeah, and before the midterm, final exam, before the final exam.
Final exam.
Yeah,
Even bigger.
even bigger. So they found that they took a blood sample 1 day before and 3 months after. They found totally different.
Night and day.
Totally different results in their immune system. Their natural killer cells, which is very important for the immune system, the T helper cells, CD4 count, all these things, the interferon, gamma interferon.
They were high 3 months after the test. And low
the immune system as a whole is weaker before the exam than after the exam.
And SubhanAllah. Now, how can we learn to control ourselves during stress? Like counting backwards from 10, meditation. In Islam, we have the concept of salat, of prayer.
This is actually a kind of practicing. You should practice how to control yourself, and this done by different ways. It could be done by praying, by changing your position from sitting to standing, from sleeping to sitting, something like that. And that's to give yourself a chance to calm down and to relieve your stress conditions. We have different ways of relieving this stress through biofeedback, which is a practice to make yourself dominate your autonomic nervous system, the involuntary nerves.
Control, mind over matter, if you don't mind over matter kind of thing.
Yeah, and this is actually a very important thing, and it's done by different ways, like yoga, like meditation, like praying is very important.
I've heard that the prayer, the reason why it's so important is because it's time we take for ourselves. Is this a key to help us through stress management, to help our immune system, is to take time out every day for ourselves? 5 minutes, 10 minutes.
If it's done well, if it's done as it should be done. But when you pray with your mind, keeping busy with what you were doing or what you are going to do, that's of course will not affect.
Rasulullah said that the worst sin is to steal from your prayer by thinking about other things. So, doctor, how do we feel pain?
Actually, we feel pain through our brain. And this is a very important thing which should be understood. We have a peripheral nervous system and the somatosensory system through which the pain reaches to our brain.
So you burn your finger, that you don't react to it, to the response to your brain tells you to.
If your brain feels this, it will respond.
Go like this.
Yeah, it will respond. The point is, if the brain doesn't receive the message or the signal, it won't respond.
And it's funny because I always said no brain, no pain. If you can't think, you don't know you're in pain.
So pain is the result of transmission of pain signals from the body to a pain center in the brain.
On this, we're going to go ahead and take a quick break, and we'll be back in a couple minutes. My guest is Dr. Hadi Misbah, Professor of Immunology and Microbiology and a Fellow of the American Academy of Immunology. And I am Ismaeel Chartier, your loyal host. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum and welcome back to Health in Islam. I'm your host, Ismaeel Chartier, and with me is Dr. Abdul Hadi Misbah, Professor of Immunology and Microbiology and a Fellow of the American Academy of Immunology. We're going to do the second half of the show on pain. Pain. I know it sounds rough, but we're going to do it. Rasul ﷺ said that when one part of the body feels pain, the whole body's in pain. The whole body is affected by it. So, doctor, how do we feel pain?
Actually, we feel pain through our brain. And this is a very important thing which should be understood. We have a peripheral nervous system and the somatosensory system through which the pain reaches to our brain.
So you burn your finger, that you don't react to it, to the response to your brain tells you to.
If your brain feels this, it will respond.
Go like this.
Yeah, it will respond. The point is, if the brain doesn't receive the message or the signal, it won't respond.
And it's funny because I always said no brain, no pain. If you can't think, you don't know you're in pain.
So pain is the result of transmission of pain signals from the body to a pain center in the brain. So this is actually the definition. As we see in this chart, that all the gate pain, all the pain in our bodies reach the brain through the gate theory. This gate theory actually is representing reach the brain, and it's represented in our sensory area in the brain. As you see over here, you find that every organ in your body is represented in this area.
It's like the Congress. Everybody has a representative there.
That's correct. So you have the foot, the trunk, the elbow, the hand, and these things actually represented over here in the sensory area. So if you have a pain in a limb, and this limb is amputated, God forbid, and this actually, you still feel the pain in your brain.
Ghost pain.
That's called phantom limb.
Phantom pain,
That reminds me also with a very interesting story from the Quran, Sayyidina Yusuf. You remember that the woman, when Sayyidina Yusuf, he was very handsome.
Some say he had half the beauty of the world or of Adam. No one knows for sure.
That's correct. So when he came in front of the woman, they
just
cut
right through their
their hands. And when you see over here, you find that the pain in the hands or the fingers the hands are the most sensitive area.
Because that's what we feel.
So, but the stimulus of Sayyidina Yusuf
was enough to make them forget about that pain.
Yeah, because the brain cannot receive two signals at the same time.
So when you're like,
So it receives the stronger one and neglect the less strong.
So it's true that you can't feel pain in two spots at once. I've always heard that. Like my dad, I'd be like, oh, my arm hurts. So he'd punch me in my other arm. And I'd be like, ow. I said, your other arm doesn't hurt, does it?
So that's very important point in pain. So what closes the gate? Distraction. If you are distracted from your pain, you won't feel this pain anymore. Or with that intensity, the relaxation, positive emotions, those are kind of behaviors which close the pain gate. What opens the gate is anxiety, worry, depression, focusing on the injury itself.
Oh, so if my knee hurts, I'm like, man,
Yeah.
my knee hurts and the pain,
Don't
it's going to make it
focus.
worse.
Don't focus.
Now, how can our immune system be affected by pain, and how is it affected?
The pain actually affects the immune system if you focus on it, because it will cause stress, and the
more stress
stress
you have
affects the immune system. But if you try to relax yourself and try to get distracted from the pain, it will not affect. A lot of things in the immune system of diseases like rheumatoid arthritis and these things cause pain, and also cancer cause pain. These things actually are received by our brain. So we have to have pain control techniques like by pharmacological control, like painkillers.
Painkillers, morphine.
We have also some sort of distraction like acupuncture, which closes the gate, the pain gate.
Pain gate's shut right
So your brain doesn't respond like the phone, but not the mobile, which has a waiting property. Just the normal phone, which doesn't have a waiting property. The acupuncture, physical therapy, transcutaneous electrical nerve, like infrared,
Easton. I had Easton down my back.
relaxation, yes, relaxation, biofeedback, meditation, imagery, hypnosis.
Now, can cancer patients resist their disease by, first of all, having faith or belief in predestination, Akthar, as it's in Islam, the belief in, your hands are, you're in the hands of somebody else? And how will this affect the progress of their treatment? If you believe in Qadr, if you believe in the divine will of Allah subhanahu wa ta'ala, of God, that you are destined to have cancer, and this is part of it, how does it affect their treatment?
First, don't surrender to the disease. This is a very important issue.
Tie your camel.
Yeah, you have to fight. You have to be a big fighter. And you have to face God. Because you have internal power, which should be raised in front of this enemy. You find that it's a battle. If you surrender, everything is finished.
Everything, it's a form of jihad.
That's correct.
You're fighting against yourself.
This is a kind of jihad, because even if you are hurt with a pinprick, you will get thawab. You will get
your sin forgiven.
Yeah.
Rasul said, even if the believer doesn't go through any pain or affliction, even if it's the prick of a thorn, that his sins aren't forgiven.
So they did a scientific research about the breast cancer patients who was psychologically sound, and the women were followed up psychologically with a psychiatrist. And
so they had both medical treatment and psychological treatment?
That's correct. And the other one is just medical treatment.
Medical only.
And they found great difference between the two groups. As the psychological state itself improves and boosted the immune system, and the prognosis was very good in this group who was psychologically dealt with than the other one.
They were the ones who had their mind and their body, the whole body dealt with. Were a lot better than the one who just had the body dealt with, not the mind, without the mind.
Yeah, and I think also those people should practice exercise, should practice salah, prayer. These things actually are very important in the daily lifestyle of the cancer patients. And, this is very important not just for the physical fitness of the body. It's very important for the immunological point of view, as it makes the immune system release endorphins. What's endorphins? They are natural opium.
So you get a sense of euphoria.
Yeah, so you feel satisfied, you feel better, feel happy. And this decreases the pain also. This endorphins, it's like morphine.
Yeah, the more if you're in, but about faith in, Omar, the second rightly guided Caliph of Islam, when he was stabbed, the only way he would get up, he's passed out, and they'd call the Iqama and he would stand. It's the only way he could get up is
Yes.
for worship.
Yes, and by the way, you remind me with who had to be amputated. So he told them, if you have to, they told him, drink some of the wine to make your conscience less. He said, no, I can't get some of the haram to make my mind out of conscious. If you are ready, just let me get into praying. And during praying, he lost conscious with the other surroundings around him. And they amputated his leg without feeling anything because his brain was preoccupied with a stronger stimulus than the amputation itself.
SubhanAllah.
Yeah.
What role does love and hate have on the immune system? What's the role of love and hate?
Very important. You know, hatred actually harms the people themselves before harming the others.
If you hate it, kind of builds up in you.
Yeah, because hatred and jealousy and
envy, hasad, all these
hasad.
things that are outlawed that we shouldn't
All
do. In
these things produce the destructive hormones which we talked about before. The cortisol, the epinephrine, the norepinephrine, all these things are destructive to our body and weakens the immune system. So love actually do the reverse. It makes us more competent, makes our immune system more sound, and it produces the productive hormones.
The Prophet said, if you love your brother in Islam, tell him. And you Muslims go around everywhere.
You know, this is very important.
I love you.
Yeah, because love actually produces some of the chemicals like phenylethylamine, endorphins, beta endorphins, and these things. Yeah.
On this note, we're going to go and leave for this episode. Our guest was Dr. Abdul Hadi Misbah, professor of immunology and microbiology, and a fellow of the American Academy of Immunology. And I'm going to close with the hadith of, you're not truly a believer until you want for your brother what you want for yourself. Jazakallahu khairan, ya doctor. I appreciate you coming here. And assalamu alaikum.